If your goal is to live in a big, busy city filled with traffic and noise, this is not the place for you. If your goal is to be incredibly competent, confident, and skilled in the practice of nephrology and every aspect of nephrology, whether it's dialysis therapies, acute care, cardiorenal syndromes, glomerulonephritis, plasmapheresis, we offer the entire spectrum of care around the discipline of nephrology.
My name is Harry Iyer, and I'm really honored to serve as the program director of this wonderful, outstanding academic nephrology program. Our division is made up of an amazing group of people that together provide exceptional cutting-edge patient care for people with acute and chronic kidney disease. We make one of the nation's premier training programs in academic and clinical nephrology. The highlight of our program, I think, is the broad diversity that excels in rigorous clinical training, knowledge gathering, and career development and mentorship for the next generation of nephrologists.
There were a couple of reasons why I really wanted to stay in London for nephro. So there's a lot of procedural exposure. You do lots of lines, both in the ICU and on the floor, which was a really important thing to me, that I wanted to be able to graduate and be very competent procedurally, especially if I was going into an attending role where I wouldn't have as much practice. So I really wanted to get good when I was a fellow. We also have lots of other kind of unique aspects, like we do a lot of Plex, which is really useful too, and we do a lot of the CRRT in the ICU. So it meant that I knew, when I started, I wasn't really sure if I wanted to do academic or community, and I knew that this would give me all the skills to kind of succeed in whichever environment I did choose. And I've seen, even going out on electives, being able to prescribe CRRT and do lines competently are things that not all programs necessarily give you the same exposure to. And it was certainly, when I was out on elective, a point of pride coming from Western, but also, programs were always impressed when you could do all of those things independently as soon as you got there.
One of the things that marks the nephrology program is our reputation for graduating leaders. And year after year, people that come out of our program have gone on to do great things across the country. And I think it's a testament for the great fellows that we have managed to attract year after year. And it's a testament, I believe, to the program's ability to equip folks with the leadership skills they need to succeed and excel out in the community. And from a research perspective, our program is focused on giving those fellows and trainees that are interested in research a real significant research experience where they can come out with the skill set and the expertise and competence to actually forge a research career.
One of the strengths of the nephrology program at the Schulich School of Medicine is that it is a very inclusive program. We have a beautiful setup for research with the Lilibeth Coberto Kidney Clinical Research Unit at Victoria Hospital, where at any one time there are 50 to 60 active clinical trials that are ongoing. And our residents have access to participating in those trials and doing their own independent research. We also have the Matthew Mailing Center here at University Hospital that focuses on transplant-related research, kidney transplants, pancreas transplants, liver transplants. And again, our residents are given opportunities to do research in the area of immunology and transplantation in a beautiful setting with a lot of resources.
If you want to be an academic nephrologist, whether it's a teacher or a researcher, we have the support and the mentorship to be able to take you in that direction. If you want to be an excellent, well-rounded clinician and go have a busy clinical practice in the community setting, we can provide that training for you as well. So when we look at where our trainees have gone around the world, it's probably about half and half, where some have landed academic roles in university hospital settings, and some have been in community settings. And we're always very proud to see, years later, many of them taking on leadership roles, so chairs of divisions or program directors for academic programs.